Okay, so this meeting is being recorded. And please, as we call this meeting to order, as we go through our business, if you can identify yourself before speaking, that will help us with our minutes. We also have an interpreter, and closed caption is available, and you can turn that on in your web assist, and then you can follow the prompts to turn on the closed captioning. The participant videos in WebEx are locked. You can lock up to 6 participants to see them regardless of who is speaking. You can customize your own settings if you would like to, board members, to make it a little easier to navigate. We have a pretty packed agenda today, and I'm Alicia Topper. I'm chairing the meeting as vice chair since Melanie is out on vacation. And it's wonderful to see you on this July 3rd. I know we have Independence Day holiday tomorrow, so thank you for taking the time to be with us. And with that, we'll go ahead and just do quick introductions. Again, Alicia Topper, I'm serving as an elected member of the CAB. We'll move it on to Rob.
My name is Rob Perkins. I'm also serving as an elected official on the CAB. And I'm serving as the secretary.
Yeah, and if after you introduce yourself, you can just call on the next person. There's a participants list on the lower right-hand side.
I see it. Amy Rourke.
Hey, Amy Rourke, and I'm a community member for District 1. And shoot, let me see. I'm on my phone. I can't see who's on here.
How about we have
Poland.
Abby take it away then?
Okay.
Thanks, everyone. I'm Abby. I'm the Clark County representative who's helping facilitate this meeting, and I will pass it to David Poland.
All right, can you see me and hear me okay?
Yes.
My name is David Poland. This is my sign name. I'm here in Hazelden and I represent the deaf community. And I'm present, so I'm not sure who's the next person because I can't see also on my iPad.
Very good. It looks like we can have Anne introduce herself with the City of Vancouver.
Hi, I'm Ann Hawkins. I'm an Associate Housing Project Coordinator with the City of Vancouver, and I am here as a guest. I will go ahead and hand it over to Dale.
Hi, I assume I'm the only Dale on the call. My name is Dale Whitley. I am the HMIS Administrator with the Council for the Homeless, and I'm here as a presenter.
Thank you, Dale. We'll have Clover introduce herself or himself.
Hi, hi, I'm Clover. I'm trying to get my camera to work, but it's not coming up for some reason. I'm with EOCF. I'm the Talent Development Manager, and I am here to participate.
Thank you for being here. And I'm seeing 2 ALS interpreters with us today as well. Welcome. And with that, I'm not seeing any other participants on the call. So we'll move on to our next item of business, which will be the approval of May minutes. And without a quorum, we're not able to take action on this item. So we will go ahead and table item number 1 on our agenda and move on to the next item, which is our point in time count and homeless count data presentation. So I believe, Dale, you're up.
Yes, thank you, everyone. Again, my name is Dale Whitley. I am the HMIS Administrator, which just stands for Homeless Management Information Systems Administrator for the Council for the Homeless. And I'm pleased to report our results for the 2024 Clark County point in time count. Can we go to the next slide? So first off, point in time count, what is it? So it's a single night snapshot, normally taking place on the last Thursday in January. So this year it was on January 25th. And so it only reflects one day, everyone that we can count within one day in Clark County. So sometimes we're allowed to do some counting on, the next day or the day after, but it always has to refer back to that one single night. Where was somebody staying on that night? So it's required by both federally and through the state, by both HUD and the Washington Department of Commerce. And HUD actually only requires us to perform the count every 2 years. So you may hear sometimes about other states nearby, like Oregon or something. There may be a county in Oregon that doesn't do a count 1 year because it wasn't required for them. The Washington Department of Commerce requires us to do it every year currently. So we do point in time count every single year. So one thing that I want to make sure that everybody's aware of is that the numbers that we're going to look at, it only counts people who are experiencing literal homelessness by HUD's definition. So there are different definitions of homelessness. It's important to remember that the numbers that we're looking at aren't going to reflect people that are doubled up or living with family or friends. Those people definitely are in need of assistance and stabilization, but they're not going to be included in our specific point in time numbers. So every year we try and incorporate whatever new tools we can or increase the effectiveness of our count. And ultimately, what the count provides us with are these yearly measures where we can kind of track over years where our numbers are trending. So it takes us another year to find out whether things went up or down or stayed the same. So it's really a long longitudinal report. And hopefully, what we learn through the point in time count can enable us to have better planning, funding determinations if we see emerging needs, population groups that are in need of further assistance. Hopefully, we can act on that. Also, I just want to make sure that everybody knows that it's what we call the best available data. So it is only 1 day. It's not like the federal government census where they have months and months and months to try and make sure that every single person is collected or surveyed. It's really just 1 day, and so we try to use the same tools and procedures that we do every year, and so in that way it has consistency. But we always know every year that there are probably some people that weren't counted. All right, can we go to the next slide? So the data sources that we use to produce the numbers for the point in time count. So for the sheltered count, there's 2 main components to the point in time count. There's the sheltered count, and then there's the unsheltered count. And so for the sheltered count, we're able to use our HMIS system because all of our emergency shelters are in HMIS. And so we're able to pull those numbers and get the counts. So for the unsheltered count, we rely on service locations. So we will, contact food banks or libraries or any place people might be counted that day to try and make sure that there's somebody there with surveys that can collect that information for those people visiting that location on that day. We also reach out to our school district homeless liaisons. They are aware of their students and families who are experiencing homelessness. They have to track that year round. And so they will provide their information to us as well to be included in the count. And then we do street count. So this is one of the big main planning and activity efforts that goes on is coordinating all these street count teams that go out all throughout our county to count people where they are. Their encampments or anywhere they could be found in their cars. And so that's a lot of the effort is planning and coordinating that. And then we also have a large Project Homeless Connect event. And so that's a 1-day service fair that we hold. Normally, the last several years, it's been at St. Joseph's Church on Andreessen. And it's a great event where there's all kinds of services that are available to be provided to people, and vendors, different agencies will be there tabling to help people that are attending the event. And so people can get food, they can get clothing, they can get haircuts and dental care, all kinds of things. And so we promote that in advance to try and get people to come to that event. And then everybody that attends the event gets surveyed for the point in time count as well. So that's one of the places where we collect the most surveys is through that Project Homeless Connect event. All right, next slide. And all of these, I just want to say, you can see that I talked about the outreach teams and the Project Homeless Connect event. There's a lot of people that contribute to make this happen. So, yeah, I just want to, give them a shout out again to our whole community for helping to make this point in time count happen. All right, so some highlights from this most recent count. Our year-round professional outreach teams planned and perform the street count. So this is a huge benefit that we've had over the last couple of years, are having this established group of professional outreach teams who already know the people, because year-round they're meeting with them, they're helping them where they are, and so they already know where to go to find people, and they already have a rapport. They already have a familiarity with the people that they're surveying, so they're more willing to provide information for point in time counts. So this has been a really, really helpful addition to us for the last couple of years. We also conduct the survey using a mobile app. We did it for 5 years now. It's called Counting Us. And that has really helped as well. We used to send people out with paper forms and pen, and we'd have try to read everybody's handwriting and things like that. And so having this mobile app, it makes it easier to pull the data when we're done. And it also, a lot of the people performing the count have said that it makes it easier. It's less of a barrier between the people when you're surveying them than having this like clipboards and paper. It's easier just it facilitates the communication basically. And we saw a growth in our attendance at the Project Homeless Connect event. So like I said, a lot of people are counted through that event. So it's always good when we have a lot of people coming to it. One, because we are able to count them for the point in time count through the survey, but also just so that they can get the services that are there. Because like I said, there are lots of amazing services and connections that can be made during that event.
Sorry to interrupt. I see David has his hand raised. Is there an issue, David? You're muted. We can't hear you.
I'm still not able to hear David's question. David, if you could hold your question till the end of the presentation, and then we'll take all the questions, if that's okay.
Now I can see the interpreter, but a short time ago, when they were replacing the interpreters, I could not see interpreter number 2. They were not pinned.
Oh, okay. I'll try to figure that out. Thank you for letting me know. Sorry to interrupt, Dale. You can get started again.
Thank you.
All right, I think we're ready for the next slide. Yeah, so this is just a photo from the Project Homeless Connect event from a couple of years ago. You can see that we were under some COVID restrictions at the time. Yeah, so we can go to the next slide. All right, so this is this was taken from one of the infographics that are available on our website related to the point in time count. And so this is just kind of a general overview of some of the top level numbers. So you can see that in the upper left there, we've got 1,366. So that was the total number of people that were counted for the point in time count this year. And that represented a 5% increase from our point in time count in 2023 for the total top level numbers. Now within that, I mentioned that there were kind of two components of it, the sheltered and the unsheltered. So in the unsheltered number was 669 people. And this year, that was actually a slight decrease from our previous year, the number of unsheltered people who were counted. And then we had an increase of people that were counted on the sheltered side. So that number for emergency shelter was 483. That was a 13% increase. And 214 for transitional housing was a 7% increase. Now, those increases normally indicate that we had more beds available. So our emergency shelters are pretty much always full. So when we see increases on those side of the count, it's because we had more shelters with beds available. So yeah, and then we can see 42% of the people counted were women and 56% were men. 323 were counted as chronically homeless, and there were 98 survivors of domestic abuse. and 39% people of color. And we're gonna talk about some of these again in the later slides in a little more detail. And the 39% people of color, so that demonstrates that people of color experience homelessness at a disproportionate rate in Clark County, because 19% of Clark County's population are BIPOC. All right, can we go to the next slide? So overall, more people were counted again in 2024, but it is possible that that rate of increase might be slowing. So while we had a 5% increase in 2024, our 2023 count had reported a 9% increase from the previous year. And in 2022, we actually had a 31% increase from 2020. And you can see that we skipped a year in there for 2021 because at the height of COVID, we did not have an unsheltered count in 2021. Next slide. So there was an increase of people within the sheltered count, as we saw earlier. We saw that 483 people counted in 2024, and that was up from 428 in 2023. And the 13% increase in emergency shelters was due to our number of year-round beds growing. We had more shelters. So there were two new Safe Stay shelters that opened in 2024. One was 415 West and one was Safe Stay number 4. That provided shelter for single adults and couples. So just those type of households. And then we also had 7% more people in transitional housing. We go to the next slide. There was also an increase in the percentage of people experiencing chronic homelessness within our shelters. So chronically homeless individuals or couples without children in shelters increased to 47%. 2024, unsheltered chronic homeless individuals or couples without children reduced by 33%. So this could indicate that their shelters, our new shelters, are sheltering more chronically homeless individuals and couples without children. So as they're adding to the shelter account, they're coming out of the unsheltered side of the account. Next slide. And yeah, so we mentioned that there was a slight decrease in total people within the unsheltered count. So the 669 people surveyed in 2024 represents a 0.4% decrease from 672 in 2023. And that decrease was driven by a reduction in the number of unsheltered single and couple households. 2024 was the first time in 9 years where the unsheltered number did not increase. Next slide. However, there were more unsheltered families counted in 2024. So I mentioned that the decrease was within the singles and couples without children households. So there was an increase in the number of unsheltered families, unfortunately, in 2024. So there were 19 more families with children in the 2024 count than in the 2023 count. And where we mostly see families being counted through the point in time count is through our safe parking program. We're seeing more families and larger family sizes staying in the safe parking program, and also through our school homeless liaisons, Project Homeless Connect event, and from food banks. And next slide, please. And our 2024 count showed a reduction in the number of unsheltered seniors. So one thing that had been alarming us in recent years is that since 2017, we've been seeing consistent annual growth in the number of seniors age 62 plus that were experiencing unsheltered homelessness, so living outside or in their cars. There were 3 back in 2017 that increased to 40 by 2023. And that number had been kind of tripling almost every year. And so we were keeping an eye on that. And then, recently, I think back in early 2022, the Bertha Place shelters opened that was prioritizing seniors. And that's where we started to see less unsheltered, more sheltered. They were moving into those shelters. And also those two new shelters that I mentioned that opened in 2024 were we found were sheltering a lot of seniors as well. So both of those contributed towards a reduction in our unsheltered seniors this year to 27. So it went down from 40 last year to 27 this year, sheltered. Next slide. We also saw a 29% reduction in the overall veterans counted in 2024. So 18 unsheltered veterans were counted this year compared to 32 last year. And then 23 veterans were counted in our shelters in 2023 compared to 21 in 2024. So a couple more in the shelters. Or a couple less, I should say. So this kind of tracks with some trends that we've been seeing in some of our other data reporting, such as our veteran by name list numbers have been trending down lately. So we might be seeing, potentially an overall reduction in the number of veterans in Clark County. Next slide. Yeah, so we talked about this earlier on one of those first slides, that homelessness affects BIPOC people at a disproportionate rate, which has unfortunately been growing over the last several years. So this year it was 39% of all the people counted, and in last year that was 31%, and in 2022, before that, it was 27%. So it went from 27% to 31% to 39% just recently. Next slide, please. Yeah, so David had asked if we could incorporate this question in our point in time count survey. And so for the people who attended the Project Homeless Connect event, on the paper form, we had added this question for attendees who identified as deaf, hard of hearing, child of deaf adult, deaf of deaf, deaf of hearing, or other. And so of those people who responded, the unsheltered so of those who were unsheltered, 8% of them identified as one of the above. And of those who attended PHC who were sheltered, 9% identified as one of the above. And then for those who attended that were neither experiencing sheltered or unsheltered homelessness, but were unstably housed or at risk, 1% had identified as one of the above. And then of those who responded, hard of hearing was the most common response with 10, deaf was 2, and then one person wrote in other as tinnitus as 1. Next slide, please. So so this slide is just to say that there must be affordable housing in order to exit clients from homelessness. So while we looked at some shifts in our point in time count, where unsheltered had gone down as more people were being sheltered, I just think it's important to remember that regardless of which of those two sections they were in within the point in time count, they were all still experiencing homelessness. And to exit people out of shelters, we must have affordable housing units to be able to move them into. So shelter is great. It's very important to help people stabilize and have case managers on site and work on their housing plan going forward. But both unsheltered and sheltered are still considered homeless. All right, next slide, please. Any questions about the point in time count?
Yes.
Hi, Diana, welcome.
Hi, everyone. Sorry I'm a little late. I have trouble signing into WebEx. Thank you for the presentation, Dale. I have several questions, but I'm just gonna ask one and then allow others to ask. Did you do any type of age range data aggregation to get a sense for that age range within, in particular, our BIPOC community? And I was curious how many of that intersected with some of the school liaison data. And I also appreciate the addition of the deaf numbers. So I was curious if there was also talk about people with disabilities and if that, beyond that, in the future.
Yeah, so some of those things you mentioned are additional demographics that are provided to HUD when we submit our point in time count. So there's lots of ways you can slice the data, and so definitely age groups are one of them. I don't know that it necessarily. I don't think there's an intersection between age groups and BIPOC race. Basically, like they ask for the races of everyone counted, and then in a separate section they ask for the ages of everyone counted. And so there isn't like a combined ages of the races as well, unfortunately. And then your other question about disabilities. So that is some of the disabilities are requested by HUD. I think mental health, I think, is one of them, mental health condition. So some of those things are submitted to HUD and are available in our fuller submission that we do to them. Yeah, if you have specific questions or things you would like us to try and provide, we can do that. If you can send me your question.
Yeah, definitely the age range, and I'm really concerned about the BIPOC being 39%. We got to look at what's happening there. Okay, thanks.
Yeah, and within that chart of the BIPOC, you might have seen that one of the highest percentages was Pacific Islander, Native Hawaiian and Pacific Islander. That's kind of been one of our growing populations, our county, and specifically Clark County and possibly Washington as well, is kind of higher. We have a higher percentage of people that are Pacific Islander than other. In fact, years ago, when I did a HUD submission, they had a follow-up question. They were like, "Your Pacific Islander number is too high," and we had to let them know, "No, this is real in our community." So. Yeah.
What year was that?
It was several years ago. It was probably 7 or 8 years ago. They were flagging that as possible error.
So for 7 years, we've had this disproportionate representation.
Oh, no, I don't know that the BIPOC percentage was high. It was just that the percentage of all of our people who were Native Hawaiian or Pacific Islander was higher than what they had expected.
Yeah. So for that population, it's been high for the last 7 years. Okay. All right.
Nationwide, from HUD's view, nationwide it was high.
Nationwide, yeah. Okay. And then I think for the disabilities, I'd be curious about the physical disabilities. In addition to this gives us a better snapshot by knowing these particular variables. I think it gives us a better snapshot of a community, the human factor of a community versus just a number. And also, what have we done other than try to create more affordable housing? So just challenging ourselves to think a little bit beyond the numbers here. And I'm curious about the school data. I want to learn more about that school data piece. Are these 19 families with, an average 3-4 kids per family, or, how many students, what grades, and, and the data too, some with disabilities or not. So the family unit data is very different than an individual data to get a better snapshot.
Yeah, and those school homeless liaisons are really a great source to get those questions answered from. Because like I said, they collect that information year round. We don't have like a year round data transfer or anything with them. So it's really just this point in time count that we get those numbers.
Yeah.
But the school homeless liaisons may have that richer data set that you're looking for.
Have they come to present to CAB before? Anybody?
No, not that I know of. I think when Lydia Sanders was on, they did, but I don't know. Since I've been
In my 4 years on the CAB, Diana, school homeless liaisons haven't come to present to the CAB, but they do regularly present data to their boards and to OSPI. So there is some state data gathered about the count of students and the grade levels.
you can find that information out on OSPI's website on this report card.
Yeah, you can. But I've long had the same question because school districts McKinney-Vento homeless liaisons are using the McKinney-Vento Act definition of homelessness, which includes doubling up, couch crashing, and other circumstances that the HUD definition doesn't use.
Yeah, because the students, when I counted like 2 years ago, there was already 1,300 students that were in the Clark County school districts, all in there, all in Clark County, Evergreen, Battleground. There was 13 something then, 13,000.
That's for one school district, actually.
Well, this was 2 years ago. I don't know about right now. I mean, that was
Evergreen alone has a McKinney-Vento count of over 1,000 each year.
so really this must only be the point in time count must only be adults. Yes.
Well, the point in time count is adults and children, but it's a different definition of homelessness is what we're saying. Like the McKinney-Vento
That's
includes
crazy,
doubled up or living with family or friends, and the point in time count is only literally homeless. So they would have people have to be on the streets, in cars, or in shelters.
This is Alicia, and I do believe that the two definitions have been different for many, many, many years, if not since the inception of a definition of homelessness. So the point in time count and the statistics and comparisons are consistent over time, even though the school age children that are more couch surfing, which is can qualify under the educational definition of homelessness, they may not be considered in the homeless point in time count. But there still is, to Rob's point, another system that does identify and does track and does report out on those numbers. So we can put forward a recommendation to community services to provide us an update from the educational sector's side on the homeless numbers and statistics. But for this particular presentation, we are following the Housing and Urban Development definition of HUD, and those are the numbers that are being reported. So very good discussion. Are there any other questions for Dale? And I also want to recognize that Jamie Spinelli also joined us, so we're one away from quorum at this time.
Yeah, Alicia, I see that Amy still has her hand raised and Faye joined in the room, so we now have a quorum.
Perfect. Okay, great. So do you have any other questions, Amy?
No, I don't. Sorry. Sorry.
No worries. Great. Did you get all your questions answered, Diana?
I did. Thank you.
Great. Okay, so one more option. Does anyone have questions?
If we can go to the next slide, my email address is there. If anybody wants to contact me as well. And I also want to let people know that all of our point in time count results, we have other reports as well that are available. They're all on our website. If you go to councilforthehomeless.org and look for data and system numbers, you'll find our point in time count reports there.
I do have one thing, Dale, and I saw that Cecily was on here. I know that the same point in time count is going to be presented at ECHO next week. So if there could be data added on there on the age range, I think that would help.
Yeah, we'll take a look at that, see what we could include.
Okay, thank you so much for joining us, Dale. It was a very informative presentation, and I'm assuming that these slides will be sent out after today's meeting and posted on our website or somewhere for the public.
Thank you, everyone.
Thank you. Okay, our next item of business, I'm going to go ahead. I didn't suspend the rules to adjust the order of our agenda this morning. I was being a little loose with parliamentary procedures, but since we now have a quorum, I'd like to bounce back to the second item on our agenda, which is the approval of our May minutes. This does require formal action from the board, so I would entertain a motion for approval.
Move to approve.
Second.
Thank you, Diana, as a motion and a second from Rob. I have a motion and a second. Any discussion? Hearing none. All those in favor say aye.
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 All those opposed, same sign. Okay, motion carries. Unanimous approval. Thank you, everyone. So our next report is going to be our July 2023 through March 2024 outcomes report. And Abby's going to take this away for us.
Yes, thank you, Alicia. Sorry, I was just struggling to get unmuted there for a second. So I am going to pull up the report on my screen. I sent this out over email, and I also have some hard copies here in the room. If you need me to send another copy, feel free to reach out and I will do that. I'm just going to zoom in a bit so we can all see it. All right, so here we have the outcomes report for the Community Action Program and Homeless Crisis Response System programs from fiscal year 2024, quarters 1, 2, and 3. So this spans July 1st, 2023 through March 30th, 2024. Most of you have seen this report a lot of times, but for those who haven't, each of the programs we have here in orange with the annual report period. And then the green section here shows the activity descriptions of each program, the annual proposed goals, and the achieved year to date, as well as the percent of each outcome that has been achieved thus far. And at this point, we are about 3/4 of the way through the fiscal year, or as of when this report was finalized. So most of the programs will be around 75% achieved, but you'll see that some of the numbers are a lot higher and a lot lower, and we'll go into the details about those. For programs that have significantly overachieved or underachieved on their proposed goals, we will receive explanations with next quarter's reports and reassess targets for the next year as needed. And then in blue, you will see the annual contract amount for each program, the total spent as of March 31st, the balance as of March 31st, and the percent that was spent. So some things to note about these community action programs that we have on the first page, and I'll just zoom out a bit so you can see it all. So I mentioned this last time, but the Clark College Financial Wellness Program ended on January 5th of 2024, and the remaining funds have now been reallocated to the other CSVG programs to fill in any gaps that we were having. Second, the Share Hunger Response Program has already spent out all funds for this year. They spent it out in October of 2023, and we expect all the other contracts to fully spend out by June 30th. And third, all of these community action program contracts that you see here have been renewed for another fiscal year at the same amount. So these will be renewed through June 30th of 2025. And then we will open a new request for applications for this funding this October, which you will all review all the applications and we'll determine how we want funding to be allocated for the following fiscal year. All right, scrolling down to the Homeless Crisis Response System programs. These are organized by program category in the same way as they have been in the past. We have system coordination and data collection, core support services, outreach services, shelter services, etc. And you'll again notice here that most of the programs are around 75% for their predicted targets. For those that are already over 100%, this is likely due to a higher demand and or capacity than originally anticipated. And again, we ask providers to provide an explanation for being outside of these targets at the end of the fiscal year. So I'll have a better explanation for you at our next meeting. And there's a few things that I want to highlight about these programs. So scrolling down, we also have all our rent assistance, prevention programs here, transitional housing, rapid rehousing, permanent supported housing programs, and at the bottom, I strike snow. So first of all, the Share Homeless Outreach Program is currently billing to other grants, which is why you won't see any outcomes achieved or spending for that program. Second, I mentioned this last time, that we had a number of new programs start at the beginning of 2024, and those include all of the EPRAP, or Eviction Prevention Rental Assistance programs, as well as the Lutheran Community Services Northwest Refugee Assistance Program. And for these, you'll notice that spending and percentages of goals achieved are quite low. Some of these programs are still working to set up their reporting documents and propose goals, which is why we have NA in some of those cells. But Kayla is working with all of these providers to ensure they get the programs up and running and utilize or reallocate funds as needed. So you'll see probably much different numbers on the next report. And then lastly, any remaining state and local funds at the end of this fiscal year will be recaptured and used to supplement the House bill deficit, which we've mentioned quite a few times. And then the last page here shows information which is pulled from the program reports and HMIS data. So on the top left, you'll see participant satisfaction survey data. So far this fiscal year, programs have sent out 4,291 surveys and received 878 responses for a 20.5% response rate. And of these responses, 91.3 indicated a positive overall experience, which is really great. Next, we have community engagement, which shows the number of volunteers and volunteer hours who help operate these programs. This fiscal year so far, there have been 1,753 total volunteers with 23,164 volunteer hours, 5,979 of which were by low-income volunteers. And this leads to a total value of $933,056. And I want to point out too that a recent report by Independent Sector at the University of Maryland calculated that the current rate of a volunteer hour in Washington State is $40.28. And this rate is being used by WASCAP, so it's what we use to calculate volunteer hour value for our reports. But that's gone up significantly since the last report, so you'll see that that value is significantly higher. Then this next chart on the upper right here shows the number of grievances received by the programs. Out of 48 programs which report grievance information, 25% have received a grievance. This is super normal. Our providers work with a lot of clients with a lot of differing complications. So receiving grievances is not something that we're concerned about. There were a total of 77 grievances received, 45 of which have been resolved, and the rest are in the process of being resolved, and staff will keep an eye on these to make sure that we see a resolution there. And we do keep an eye on the number of grievances received by each agency, and we'll know if there are any red flags that come up. Then on the bottom here, just gonna scroll down a little bit more. We have an overview of some of the demographic information that we collect. Not all programs report on every demographic, so you'll see the number of responses for each demographic at the top of each chart vary a little bit. And this helps us get a better understanding of who is engaging with our programs and where we might be missing people, certain demographics. So first we have age. You'll see that most of the participants served were between the ages of 24 to 44. We also have about a third from older adults and a third from people younger than 24. When looking at gender, the majority of participants served identified as female. We had 38% who identified as male and 1% as gender nonconforming. When looking at education, a slight majority were high school graduates or had their GED, with about a quarter representing each of these other categories. When looking at race, the majority of participants served were white, though this distribution that we see here does mirror the overall demographic distribution of Clark County, especially when looking at those who are experiencing poverty or experiencing homelessness. And when looking at other characteristics, we saw 1,683 individuals who are chronically homeless, 358 veterans, and 3,168 individuals who had a disability. So that is all that I have for these charts. Does anyone have any questions?
I do. I was wondering on the volunteer thing, how did you guys come up with the $40 an hour? What about it averages out to?
Yeah, so that is determined by, it's called a report by the independent sector at the University of Maryland. This is kind of the standard that nonprofit agencies across the nation use to calculate their volunteer hours. They break it down by state, by region, by county. So according to that report, the current value for a volunteer hour in Washington State is $40.28. And we received this information from WASCAP, which recommended that we use this value moving forward.
I was just wondering because I know the opposite equity, it used to be $45 an hour, and now we just did the updated the guidelines, and now it's 56. I just was wondering how you guys got that. But thank you.
No problem.
This is Jamie. I have a question.
Yeah.
Up on the other report up at the top,
Mhm.
some of the unspent funds, how they will be spent. Are there any unspent federal or ARPA funds that were unspent?
No, all of the federal and ARPA funds have been fully allocated out into contracts. I know that Kayla and Luis are tracking that pretty closely. And I really don't think we're gonna have any remaining funds there.
Okay, thanks.
Any other questions?
Okay, thank you so much, Abby. Very, very good report. And I'll just ask one more time, do we have any other questions before we move on to our next agenda item? Okay, hearing none, sorry. We'll move on to the City of Vancouver's Affordable Housing and Homelessness Update. And I'm gonna assume that we have, I don't see Sam on the call.
Join at the nick of time.
Oh, yay, welcome, Sam. So good to see you.
Hi, well, thanks for having me. There's not a whole lot of updates this time. So we are underwriting the awards that we made in the spring, doing some environmental review, trying to get those contracts underway, get all the programs started that we funded with our CDBG funds. One maybe interesting update from housing is that we've started convening a community group to look at rental unit habitability, health and safety, and inspections, and how we can support landlords and tenants. And Amy is helping us out on that committee, so really appreciate her time and advice. We have about 20 people on the committee. There's landlords, property managers, tenants, service providers, attorneys, mediation. So we're trying to get a broad perspective and feedback as we start to look at what the city wants to do to increase housing quality in the community. And we will take this committee's recommendations back to City Council in the fall, and then see what we implement and what changes are put in place with their approval. If anybody has any questions, or I'm not, and maybe Jamie is here to do the homelessness update. I just know a little bit about that, so I'll pause, but I can provide a little bit of update if needed.
I don't actually have, unless anybody has questions.
I did see an article in the paper recently, Jamie, about the city's stance on not enforcing the camping ban. Can you elaborate a little bit more? I know Portland is starting a more aggressive approach. Do we anticipate that that's going to have an impact on Vancouver, and how is the city moving forward with the new court decision?
Thus far, no changes for us. The ordinance that's been in existence for a long time still stands. There was nothing that was unconstitutional about what we already had. It's certainly, this is a conversation that council will need to have amongst them. There was a little bit of conversation about it Monday night towards the end of the meeting. But it has been, well, I was going to say that we don't have other places for people to go at the moment. And nor do we have enough jail or law enforcement capacity to round everybody up every day and attempt to enforce that. So my recommendation has been and remains that we wait until we've got more shelter and housing capacity for people to go before enforcing anything.
Is that the Grants Pass versus Johnson?
It is, yeah. Well, I suppose one update is that so community court has been operating at Recovery Cafe. They've been kind enough to donate their space to us every week, but they space back now, and we are growing. So starting likely next Friday, community court is moving to it's called the Zen Building. Probably no one here knows it as that, but it's the building. It's right next to Hope Village on 4th Plain. Same building at 4th Plain forward. In community court will be moving over there, I believe, starting the 12th. And we're looking at an eventual expansion to an all-day Friday versus just the half day that we've been doing, to increase capacity for that. And the reason I mention that is because that is typically the go-to citing people for, very low-level crimes or camping-related crimes to get people connected to services versus actual enforcement.
We will add, relative to the Grants Pass decision, it doesn't change what we're doing significantly, but what we are doing is looking at it and studying it rather than just not doing anything with it coming out. But at first, it's we don't anticipate to change anything of what we've been doing. But we're also looking into it now and studying a little bit more and seeing how that fits into our future here and how we've been managing. So stay tuned.
I would say, just for the benefit of the public or anybody else who watches this or doesn't know, there was a lot of confusion, it seems like, from the general community about what the decision meant. And we got a lot of calls saying that the Supreme Court just criminalized camping everywhere. And so now we're out of compliance and we're going to be sued for being out of compliance. And that's not accurate. It didn't criminalize anything. It just said that jurisdictions, localities can criminalize. But the ordinance that we have still stands, and there are processes, public processes required to change ordinances. So that would be something that would be relayed to the public if it was gonna be up for discussion.
Perfect.
And
Thank
I
you, Jane.
imagine all the other jurisdictions are in the same, like assessing what that means for their areas.
Yeah, I was just going to make that same point, Diane. I was going to say that every governing body that has an ordinance around either enforcement or penalizing people who are unsheltered, they would have to like review it. The PA's office, public attorneys would need to look at it based on the law. So, but I do appreciate the City of Vancouver's diligence and compassion around the issue. Any other questions for the City of Vancouver? We've got like all their experts and a council member here, so we are very fortunate. Okay, hearing none, thank you so much for that update. Always very informative. We do have several task forces that are active at this time, and so this is the portion of our agenda where we get to hear an update. So we'll go ahead and start with Amy. I know we're not in a legislative session right now, but we do have a legislative advocacy group. So is there any updates?
Okay, so, well, I guess we've determined that we're going to go off of the community needs assessment results from 2024. And so our top five identified in the community needs assessment was food assistance, dental assistance, housing assistance, asset building, and utility assistance. So yeah, that's what we've determined. And then of course we got Washington Low Income Housing Alliance that we usually always follow too. And theirs is of course rent stabilization's number one. And I don't think we have any bill numbers or anything yet for any of that. So that's what I got.
Okay, thank you, Amy.
I
And
think that we need though to do an approval of those categories.
okay, so are you making a motion for the CAB to endorse?
Yeah, I was just trying
the
to, yeah, I was
legislative
trying to read.
proposal?
Yeah, yep, that's what I'm gonna do. I'm making a motion. Yes.
Okay, so Amy has made a motion and there's a motion on the floor to approve the legislative agenda for the Community Action Advisory Board, which includes, will you give that list one more time, Amy?
Yes, food assistance, dental assistance, housing assistance, asset building, and utility assistance.
Okay, so is there a second?
This is David, I second.
Okay, we have a motion, and a second. Is there any discussion?
I have a discussion point relative to the data we just heard from the point in count time with regard to a disproportionate representation in our houseless community. How do we emphasize or embed that into some of the legislative action to help take a look at that as far as some preventative measures with an emphasis on our BIPOC community, especially if we're for the younger generation, is it leaving room for some of the school issues there?
So would you like Diana to offer an amendment or an additional item for this motion?
I think an additional item to this where we can have a feasibility look into cause and effect for why we're having such a disproportionate representation in our houseless community.
So
and
I'm going to ask,
consider.
thank you, Diana. I'm going to ask the individual that provided the motion if they would consider that a friendly amendment. Amy, would you be okay
Yes.
adding that item to our legislative agenda?
I would be.
Okay, so we don't need a motion in a second. It's a friendly amendment. So the motion now includes adding the disparate impact that is placed upon our BIPOC community. So we'll follow any legislation or proposals and either vote pro or con based on those parameters. Any other discussion? Is there any other discussion on the motion on the floor?
Yes, one last point, Amy. I don't know if the Washington Low Income Housing Alliance has anything focusing on the BIPOC community, but
I don't think that they do
suggest reaching out.
specifically. Yeah, I can email Michelle and find out, but I don't think that they do
Yeah.
suspend.
And if not, if we can elevate that as a priority item from this region.
From this from this region, I'm sure we might. Yeah, I'm sure that we probably could ask that. Yeah, I was gonna say because I don't think it's like that all over Washington, but yeah, I will talk to Michelle.
Okay, thank you for that discussion. Any other discussion? Members of the board? Okay, hearing none, I'll close the discussion and we are considering a motion. We'll go ahead and do a voice call. If it sounds close, we'll do a roll call. But all those in favor, please unmute yourself and reply aye if you're in favor.
Hi.
Aye.
Aye.
All those opposed, same sign. Okay, motion carries unanimously. Thank you so much for that amendment. Diana and Amy, thank you so much for that report and motion. We now have a legislative agenda. So the committee will be acting next year throughout the session, voting in favor or in opposition on our behalf. And if there's anything that is outside of what we've approved, they would likely come back and ask for our direction. So thank you so much to that committee for their work. Okay, our next is our Community Needs Assessment Task Force. Abby.
Thank you. I actually don't have any updates on the CNA right now. It's still in hands of the Clark County Communications Department just to get the final layout of the translations done, and then it will be ready for publication and distribution. I will be sure to send you all copies when that's done. For the Policy Task Force, we are currently working to revise the Code of Conduct to include behavioral expectations and ethical conduct for CAB board members. And that is almost complete. Huge thank you to all the members of the Policy Task Force for helping us move that important work forward. And once we have a revised Code of Conduct or any revisions to the bylaws, that will be brought to the CAB for approval. And that will likely happen at the next meeting in September.
Okay, thank you. And I see, Jamie, you have your virtual hand raised. Did you have anything to add?
No, an accident. It's just still raised from the last time.
Okay, no worries.
Sorry.
I saw you being patient with your hand up, so I just wanted to
Sorry,
check. Okay, thanks for those updates, Abby. We have a CAB Equity Initiative discussion as the next item. And that's you again, Ab. I'm going to call you Ab instead of Abby, sorry.
That's great. Thanks, Alicia. All right, so as many of you know, we're working to expand on the equity training that we had with Wally in April and just facilitate more opportunities for learning and conversations around equity on the CAB. So to do this, we have secured some funding for a 6-part equity training series, which will be held from August 2024 through June 2025 during the even-numbered months that we don't have regular CAB meetings. And we haven't locked in specific dates yet. I'm hoping that they'll fall on the first Wednesday of the month, just so we can keep it consistent, since that seems to work for people. But I will be sure to reach out as soon as I have more information on the dates for those. And as of yesterday, we confirmed that Ma Caroline Lopez will be facilitating this series. Ma Caroline is a really wonderful trainer and person with lots of local experience. She centers relationship building and connection in her approach. So we're really, really excited to work with her. I think that she'll be a great fit for the CAB. And importantly, the CAB executive team has decided to make these trainings for CAB members. And attendance expectations will be the same as our regular CAB meetings. So if you can't attend, just send me an email in advance and your attendance will be excused, but otherwise we really expect members to make every effort to attend. And we also expect folks to really try to attend these in person, especially for these types of personal conversations. It's really beneficial to have folks in the same room, especially if we're trying to foster that kind of connection and relationship building to help us move forward in our work. A hybrid option will be available, but really only for those who can't attend in person for a specific reason. So again, I will follow up whenever I have more information, but I'm really excited that we have this opportunity for our members. And I'm excited to go through this work with you all. So as we're working to finalize the agenda and topics for these meetings, I just want to provide an opportunity to get some feedback from you all on the priority topics and goals for these trainings. So I just want to open up a discussion for the next about 20 minutes about what topics we want to prioritize, if there's anything specific that you're hoping to learn or discuss, and what we want to get out of these workshops and what are our goals for the CAB. And also, if you all have any questions about these, now would be a great time to ask.
Hi, Abby. This is Diana Perez. Question. So I know Ma Carolyn gives the training, and currently she's giving training right now on several series. If we're already signed up for those outside of CAB, rather than duplicate the training, could we just let you know we're doing that training?
Yeah, that's a good question. So this training will be pretty specifically tailored to the CAB, and there will be a lot of opportunity for discussion about how we want to implement an equity focus on the CAB specifically, how your experience contributes to your approach to this work and this group. So even if you are already doing other equity training or other really similar equity training, I think it's still really important to have members attend this one because it will be specific to this group.
Okay. What if I'm an equity trainer and I give training to other groups? So I just want to acknowledge that I think we're all at very different levels within our equity centered thinking, and appreciate that. The push for CAB to learn and grow within that and apply those principles and foundations into our decision making and thought process and building our muscle brain for that. So just want to shout out that at least that I appreciate that. But there is a lot of training happening outside too, so we don't want to overwhelm our volunteers at that same point. So I don't know who else is signed up for the training with Ma Carolyn, but if there was a little more focused intention onto what specifically from CAB we're wanting to change or grow in, I think that would help.
Yeah, and I wonder, Abby, for the CAB, since we are under the auspice of community services and your strategic plan, and there was an intentional focus on adding more equity and inclusion into that plan, is there a tie or a conduit for us to focus on areas that are in the strategic plan around our learning? I'm just wondering if there's a way to marry the two.
Yeah, absolutely. So I actually sent the strategic plan to Ma Caroline, and she's reviewed those tenets that were established, and is really going to try to incorporate those goals and expectations into our training to make sure that, everything is well suited to this board.
Okay.
You said you got funding for it. Is that for the person that's doing the presenting, or is that being that people on there would be compensated for their time, or is it just strictly volunteer?
Yeah, that's a good question. The funding is only to compensate Ma Caroline for her time facilitating and planning these trainings. Unfortunately, we don't have funding to compensate members for their participation.
Not to derail this discussion, Abby, but when it does come to inclusion for our low income representatives, it would be helpful if community services put in a budget package request that would include some form of compensation for time, especially if the trainings are during the workday. We're asking a lot of those individuals if it's a mandatory requirement in our bylaws. And it's budget time right now, so it's not too late.
Right. It's usually a best practice when we have volunteers from the community to attend any type of training. That's part of
and those in the public sector, we can not, opt in to take a stipend, but for those that are impacted financially from participating, I think it would be within CAB's best interest to follow best practice.
Yeah, absolutely. I do appreciate that. This funding was we had to scramble it together to create this opportunity for board members. I will bring it back to county staff and see if there's any potential for member compensation. I agree that that would be a really great thing to have, especially if we're asking folks to, you know, volunteer their personal time during work hours. So I'll see if we can make that happen, but at this time, we don't have that funding set aside.
What is the time commitment on those? Is it as long as these meetings or?
Yeah,
Is it a
it'll be the same as these meetings.
But it will be in addition to these meetings.
Yes, that's correct.
Yeah.
Abby, I think it would be good to back to the point of tying this into the purpose of CAB and what the outcomes we want from these trainings because of that commitment of additional time and investment for our volunteers. So I think if we were to focus on the outcomes that we want from the training, would be really good to get a, you know, better understanding of our investment of time.
Yeah, absolutely. I mean, I know what outcomes I have in my head for what I think would be great to get out of these, but this is why I'm opening this up for conversation, because I'd really love to hear from you all what you want to get out of it. And I also see some hands raised. It looks like Jamie's went up first.
When I support the potential, you know, budget request for stipends for to attend. The second thing that I was going to say, actually, kind of, I thought of it when Diana had made her comment about, you know, people being in different places on their in their education journey and whatnot. That's just in recovery, so I attend all recovery meetings, and one of the things that we talk about a great deal in those meetings, similarly, is that everybody's in a different place in their recovery, and it's just as important in those meetings. Maybe this is different, but it's just as important in those meetings for long timers, what we call long timers, to attend as it is the newcomer. Because everyone learns from each other. Everyone, you know, the newcomer is going to learn a great deal from conversation and stories told by people with decades of recovery. People with decades recovery are also going to learn and hear things from the person with 24 hours. So it just made me think of that, you know, certainly there is value to having a diversity in the amount of experience in the room when we're having these discussions. That's just my opinion.
Thank you, Jamie, and I 100% agree with that. So thank you for pointing that out. I see David's hand up next.
Can you hear my voice okay?
Yes.
First of all, I want to say thank you, Diana, Alicia, and Amy for what you said, because I agree with what you said. I do have concerns, again, about getting more people to participate, people that we say we want. The whole DEI thing is about recognizing the diversity that we have here, but not superficially. That we need the groups of people that we have that live here to participate, so we're aware what the issues are when they pop up. Why we have the numbers and statistics of people homeless that are Pacific Islanders. We need to know why. So they are the best person because they have direct lived experience to share that information. That's why I'm the deaf representative, because I know. For the same reason, I get concerned that I see that things have been happening recently, such as now our meeting's going to be 2 hours long at a time when most people either work or going to college. And that can be a conflict for some people to be participating. And now we're going to add also a requirement for even months, so that every single month of the year, you have a meeting for 2 hours. That's a lot of expectations of people who maybe just got out of prison, people that have lived on the streets recently, people who English is not their first language, people with disabilities, all these people that are low income probably, to participate and go, especially in person. The travel expense by bus, how many buses for me? 2 buses to go there. That's a lot of work for them. And again, accessibility, if they go in person, maybe English isn't their first language, maybe ASL interpreters there, but maybe they need Spanish, or maybe they need an Asian language interpreter. Yes, that is a budget expense, but also thinking about what the meaning, what the intention is when we say we want diversity to be represented and we want to respect people so we can include them because they're vital. We need them. So I'm concerned about that. And I just want to say again, thank you so much for the three of you speaking up about what you did. And I hope we can have more discussion about that, the time commitment and the requirements.
Thank you, David, for pointing that out. And that is a really great reminder. So if anyone does need accommodations for transportation or interpretation, we are able to provide that at the county. So if you need, bus passes or any type of assistance regarding that, or if you need an interpreter, let me know and we'll make sure to make that happen so that you can attend in person. Looks like Rob's hand is up next.
Hi, thank you. This is just to say that if you do identify a funding source for a stipend for these meetings, please also provide a mechanism for people who don't need it to decline it.
I also want to say one thing too. I think if you check, it's called PLEE, and it's with HUD. It's people with lived experience. Anyways, at the end of there, it has like 4 or 5 different. I can send it to you actually, Abby. Different places that through HUD that you can ask for resources or for funding for people with lived experience on boards and stuff. And also the Office of Equity has community compensation guidelines for the state of Washington for class 1 groups, which I believe that this is a class 1 group.
Thank you, Amy. I'll definitely look into that. All right, so moving back to these questions, are there any specific topics that you all want to make sure we prioritize, or are there any outcomes that you're hoping to get out of these workshops? What are our goals as we're going into this?
I think what I heard, Abby, is that it have some relevance specific to CAB and our objectives and our strategic plan.
Yeah, absolutely.
Is there anything else from members of the CAB?
No, I think that pretty much for me, does that just how do I phrase that? Relative to, but I think it's helpful to know to hear like how specifically can we be using what we're learning in discussion, in decision making, in advocacy, things like that. I think some of those just like really spelling it out for folks is helpful. How we will use it in this work, or we could use it in this work.
Great, thank you, Jamie.
But I think some assessment of where we're at in our practice and individually, but then as a group, where we're at. So we know where we need to strengthen some areas or develop that muscle brain. And then the application really is key because that goes out to the outcomes. I think once we understand where we're at, I think that would be better to identify what specifically we need to learn as a team. I mean, there's the basic.
Yeah, I absolutely agree. And Mont Caroline's proposal actually did have, a check-in and assessment at during the first meeting. So I think that will be really great, but I'll make sure to get that feedback back to her that we want to prioritize that.
Okay, did you get what you needed, Abby?
I wanted to say something too. Is kind of, well, this is there, but I think that I've been recognizing and noticing from different boards, different committees, different everything, that recognition, like something that I don't know, even like a board at the community center right there. I mean, down at you know, down there, the BHA right there, that in that building. What is it called? Where you're at, Abby? Anyway, something that like shows that I don't know, people that I don't know, things that they do, you know, and things that they're recognized for. And so people need purpose, you know, and when people are homeless and they are low income, and some people just don't have purpose. I know myself, I didn't have a purpose till I got on a board, really, until I got on the poverty reduction work group. I didn't really have a purpose. I had kids, but I didn't have a purpose, and that gave me a purpose. And from there, it's just kind of grown and grown and grown and grown. And I just think that I know when I'm recognized for things I do, it makes me super happy, even if it isn't just for, you know, just to be recognized, you know, something like maybe a board that has things of people that are doing good in the community, you know, and to recognize them. Does that make sense? What I'm trying to say?
Yeah.
Okay.
Abby, I also want to add environmental justice, because houselessness and homelessness is an environmental justice issue. But going back to the basics of environmental justice, which started with the civil rights movement, and having that baseline foundation and how that transcends into us focusing on and addressing the homeless situation.
Great, thank you, Diana. Faye, did you have a comment?
I can't remember what it was. No, everybody does need to be recognized. A pat on the back. Everybody wants a pat on the back. I don't care how high up you are or how low down you are. Everybody needs to be told at some point in time that whatever they're doing is great. In some way or another, give them a certificate. There has to be a way to acknowledge people who do well and who work hard. It's incentive for other people to do the same.
Yeah, I agree. Thank you. And I do appreciate you all. You are doing amazing work, and I really appreciate you guys being on board with this equity training. I know that it is an additional commitment. It's only 1 year, and I really think that it's going to set our board up for success long-term, to, you know, build relationships, establish goals together, and really make sure that the work we're doing is centered in equity. So thank you all. I really appreciate it. And again, if, you know, this isn't possible for you to attend, obviously we can excuse absences if needed. Just feel free to reach out to me offline and we can have a separate conversation about that. Is there anything else that we want to discuss about the equity initiative?
Okay, hearing none. Thank you so much, Abby. Sounds like we've got some good direction. We do have a section on our agenda that is a platform for open public comment. Is there anyone in the room today, Abby, that is wishing to address the CAB?
We don't have any guests in the room today.
Okay, is there anyone online or by phone that has joined us that would like to address the CAB during our public forum? Is there anyone wishing to speak? Okay, we're going to close open public forum. Is there anyone wishing to speak? Hearing none, we'll go ahead and close our public forum and we'll move on to the agenda item and announce other business. Please note that our next CAB meeting is on Wednesday, September 4th from 9 o'clock until 10:30. And I'm not sure, Abby, did we extend the time of our meeting to 11? So the agenda needs to be amended to reflect that?
Yes, meetings are extended to 11 just so that we don't have a hard cutoff at 10:30. Obviously, we're done at 10:30 today, which is great. We don't need to push them to 11 if it's not necessary, but that was really to create extra time for conversation. We've received some feedback that the agendas were just too packed to be able to ask questions and have the conversation we needed. So they're extended to 11 as needed.
Okay, perfect. So mark your calendars for the extra half an hour just in case. Is there anything from the CAB board before we adjourn? Okay, hearing none, I wish everyone a safe Independence Day, and hopefully everyone will stay cool. If you have neighbors that are elderly or frail, please check in on them. It's going to be a hot couple days here in Clark County. There are several heat advisories. So please stay hydrated, be safe, and we look forward to seeing you all in September. So thank you, Abby. Thanks, everyone. Meeting is adjourned.
Bye.
Happy 4th of
Thank
July.
you.
You too.
Bye, everyone. Thank you.
Next meeting, if somebody's volume is that
Trying to leave, but it won't leave me. Ah. Okay.
Right.
Sorry. My mouse isn't working here. I don't know why it's not letting me leave. Okay. I'm going to try something different. Bye.
Bye, Diana.